Can weak pelvic floor muscles lead to recurrent UTIs? Imagine your pelvic floor muscles as the supportive net holding up your bladder and other pelvic organs. When these muscles are weak, it can cause more than just leaks or discomfort. Weak pelvic floor muscles can actually play a role in recurring urinary tract infections. The connection is complex but important to understand for anyone dealing with frequent UTIs. The pelvic floor muscles help support the bladder and control when you urinate. If they are weak, the bladder might not be held in the right position, which can lead to issues like urinary incontinence or even pelvic organ prolapse. Pelvic organ prolapse happens when organs like the bladder shift downward due to weakened support, which can interfere with normal bladder function. This misalignment can cause incomplete emptying of the bladder, leaving urine behind. When urine remains in the bladder, it creates an environment where bacteria can grow more easily, increasing the risk of infections. In addition, weak pelvic floor muscles can affect the nerves that control bladder function. This may lead to symptoms like urgency, frequent urination, or difficulty fully emptying the bladder. All these factors can contribute to bacterial buildup and recurrent infections. Sometimes, the muscles may be overly tight instead of weak, which can cause similar urinary symptoms, but in the case of weakness, the lack of proper support is the main issue. Treatment for recurrent UTIs related to weak pelvic floor muscles often involves pelvic floor physical therapy. This therapy aims to strengthen the muscles, improve bladder support, and help ensure complete emptying. In some cases, devices like pessaries or surgical procedures may be recommended to correct prolapse and restore normal anatomy. Addressing the underlying muscle weakness is crucial because simply taking antibiotics repeatedly may not solve the root problem if the support system remains compromised. From a bladder health perspective, maintaining strong pelvic muscles is vital not only for preventing recurrent infections, but also for supporting overall bladder function. Chronic infections and incomplete emptying can lead to inflammation, which over time might contribute to other bladder issues, including conditions that could increase the risk of bladder problems or even bladder cancer. In summary, weak pelvic floor muscles can indeed lead to recurrent urinary tract infections by causing poor bladder support, incomplete emptying, and pelvic organ prolapse. These issues create an environment conducive to bacterial growth. Effective management involves strengthening the pelvic muscles through physical therapy and addressing any anatomical problems alongside standard UTI treatments. Always consult a healthcare professional for personalized advice, as individual conditions vary and proper diagnosis and treatment are essential for optimal bladder health.